Hello, everyone. My name is Max Moreno. I am an associate professor at the Department of Global Health at the Fairbanks School of Public Health. I am also the director of the program of the Master in Science in Global Health and Sustainable Development and the Master in Public Health in Global and Environmental Health. So I'm here today to give you a brief introduction, a brief information about what the program of the Master of Public Health in Global Environmental Health is. And hopefully you will decide to join us when you realize how fun this subject and how important it is for the for the good of society in general, and sustainable development, because that is also a topic that we give some emphasis, even though our main interest is public health and global health. And in what it regard to environment, it is all the determinants that are out there in the surrounding physical environment, all those factors that surround us that determine public health. So that is the main focus of this program, and also with a strong interest in global aspect, global issues, specifically or mostly mainly climate change. Saying climate change is such an important environmental factor at the global level that is influencing since now public health and will be increasingly being more and more determinant on global health as a whole. So I have prepared a few slides for you to provide this kind of information or description about the program. I will then share my screen to those slides. We will start talking about those. You see my screen, right?
Yeah, I can see it.
Okay, cool. So this first slide has some students in your program, and some of them have already graduated. And you can see also within our dean. He's the dean of the Fairbanks School of Public Health. You will then have an opportunity during the course of your program to have more connection and more conversation with him, and just like with all the faculty in your program. So what is the vision of this program? The vision of public health in general. So we will start with the vision of public health, which is the overall aspect of this master. The vision of public health is healthy people in healthy communities. So this is important to keep in mind, that public health is all about the health in the community, in the population, not doing that much emphasis with the health on the individual. Of course, it care about the health of the individual, but because the union of many individuals is the population. So overall, the objective, the main idea of public health is pursuing the health in the population. So the mission of public health is to promote physical and mental health, prevent disease, injury, and disability. So some common misunderstanding or misconceptions or sometimes confusion that are out there is the definition between medicine and public health. Very often are considered like interchangeable. They are actually, even though they are strongly related, they have two different focus. Medicine focus on the health of the individual, while public health focus on the health of the population, as I previously mentioned. Medicine focus on treatment, curing the individual when the individual is already sick, while public health look for prevention. So he tried to prevent the disease, not curing the disease, but preventing the disease. So it worked on the healthy people, so they don't have to use the physician. Actually, they don't need a medical doctor because they don't get sick. So that is the goal of public health, prevention of disease. And then medicine focus also on medical care to treat illness and injury. Public health focus on environment and the environment in the human behavior and lifestyle to prevent illness and injury. So those are basic distinction between what medicine and public health is. So it's nice to quote this sentence from the Everett Koop, medical doctor. He's a former U.S. Surgeon General during the government of Ronald Reagan. He say, healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. And this is as clear as transparent water. And we usually don't give the importance to public health that it deserves. We usually think about health once we are sick, and then we go to the doctor. When we are scared, when we're afraid about the consequence of any illness that we are suffering at the moment, then is when we look for professional attention and we go to the medical doctor. But in order to avoid that problem, we should care about health all the time when we are healthy. So this way we won't have to eventually go to the doctor. So the Fairbanks School of Public Health is fully accredited by the Council on Education in Public Health, and also is now accredited. In fact, is the first United States school accredited by the Agency for Public Health Education of Europe. So we got accredited by this organization in 2019, and we are the first school in the United States with that accreditation, which is the accreditation in Europe. So the coursework in our program has been designed according to the 17 Sustainable Development Goals. As I say, we have sustainability and balance with the environment as one of our goals of our orientation. So the idea here is that public health strongly depends on a healthy environment. So the better is the health of the environment, the more will be the chances of having a public health, since the environment, the physical environment is among the most important determinants of public health. And also the socioeconomic, the social environment is a strong determinant of public health. In many aspects, you will say that is even more important, but even that we could consider it as environment, because we can talk about the environment from the point of view of the physical environment, or we can talk about the environment from the point of view of the social environment. So either of these two definitions of environment you use, the point is that sustainability align very well with those two definitions and with those two goals. The Sustainable Development Goals that have been set by the United Nations to be achieved by 2030, they were set in 2015 in Paris. So the idea is to either achieve this goal, hopefully achieving this goal, or getting as close as possible. So all these goals are based on a type of development that will be in balance with the physical environment. So we have getting those goals to orientate the courses that we have developed. that we have designed. So in this way, these courses will be oriented toward educating, toward providing information and knowledge about public health and about the environment, about sustainability, and about all of those aspects relate to provide public health. So those are the courses. We have a core on public health. So the first 4 courses that you see in this curriculum, they are shared with the other MPH, with the other programs for MPH in our school. So in other words, the MPH in the Department of Social and Behavioral Science, also the MPH in the Department of Biostatistics, the one in epidemiology, the one in health policy and management, all those students seeking those tracks in their MPH will be taking the same classes. So when those classes are offered, when you take those classes, you probably will have fellow students from any of those tracks of public health. So the important point is that all of our MPH will have the same basics on public health, the same core on public health. And then after having the core in public health, we then have a core in global environmental health. And those 5 courses, those 6 courses that you have here in the second section will constitute the core. And those are the courses that I was mentioning in my previous slide that will be oriented toward health and sustainable development. So those 6 courses were the ones designed according to the 17 Sustainable Development Goals. And then lastly, this third block is constituted by 3 electives that you need to take. So you can, from that bank has 5 courses, you can choose 3 out of those 5. And in some cases, you can also propose a course of your interest that is from another program. Could be another department from our school, or in some cases could be even from a different school. So if there is a course that is a lot of your interest, you can propose to us. We study the course, and then we think it aligns with the aim, with the goal of the program, and then we let you use it as one of the electives that are required for this program. And then finally, you will have to do an internship and a final project. Then in the internship, you will have the opportunity to get a sense of what is the work in the real professional life. So most students do it during the summer, but you can also do it during the fall or during the spring. The idea is that you will look for a place in an industry, in any institution, in any agency, in any organization that works in topics related to environmental health and global environmental health. So you propose to them to do an internship. Sometimes some of those organizations, they actively seek for students that are willing to do internship in those organizations. Sometimes the institution don't normally have those services, but you can still propose them and you'll be admitted. And then you will work with them and you will complete a number of hours. And then you will present to work products from that internship. And then the final project is sort of a research project, most of the time, doesn't necessarily need to be research, but we prefer research project, something in which you exercise the knowledge you have received during the coursework, and you apply that to research to obtain some findings, to hopefully find something that will be worthy of publication. So we strongly encourage that our students, when they do this final project, they have in mind the intention of publishing it in a journal. So if it doesn't get to the level that is suitable for publication, is you can still get a good grade, you can still get an A, but if the project is so good that is suitable for publication, for at least to be submitted to a journal for consideration to publication, that is because the project is really, really good, and then for sure you will have more ensure the A or A plus in this. So here is the idea is that you get a is to be a researcher. So you will do a small project. It doesn't need to have the rigor of a thesis, but the idea is that to get as close as possible to a real thesis. You will then submit a paper in which you provide your results. The paper should have all the section of a research paper. So it should have presentation, page, an abstract, an introduction, a methodology, results, discussions, and then the reference. And you will also do a presentation, an oral presentation to defend the findings, to defend what you found in your paper. So these are the two programs. We have, we offer 5 programs, but 2 of those programs are directed by me. I am the director of these 2 programs, the MPH and the MS. They have some similarities, but the MPH have more coursework and has a formation more complete, as it also includes the internship and the final project, which will give you more experience and more practice in events, in works that are those that you will be doing in your future, in your professional life, in your professional career. So what you will be doing with your degree, there are plenty of fields in which you can work with this degree. Fields that are related to public health, to globalization, to global health, to global issues, to environment. So there are works related like environmental specialists, environmental officers. You can work for state agencies, for governmental agencies at the federal level, at the local level, at the state level, for the private sector, for academia, for private institutions. As an environmental specialist, as a public health officer, also a non-governmental organization is another important field in which you could work. Especially agencies that are related to global issues, to international issues, because we place a lot of focus in global issues, in global aspects, public health at the global level. So we have a system, a package in which we also provide you with guidance about how to apply for jobs. Amelia Hort, she's the director of the career services. So she can help you to orientate you, to train you about how to create your CV, how to apply, how to present to interviews, how to relate to the the interviewers. In general, information that will be helpful for you once you get your degree and you get out of the let's say real work, when you work on your career. Also, while you are still a student, she can help you finding places to do the internship. So she also distributes those bi-monthly newsletters with opportunities that you may wanna pay attention to those for any opportunity that arise. So there are extracurricular opportunities that you will have a chance to participate on. Those opportunities, many of them relate to situations, to problems, to solving problems in the communities. So, so you will have also chances to do that if you want to gain experience and to strengthen your commitment with public health and the community in general. So the Public Health Corps, the Public Health Practice Center is a volunteer program. You can participate in it. It works with the public health practitioner and administrators, so you will have a chance if you want. That you don't have to, but it's a good opportunity to gain experience. You will have a chance to work with the expert, with other people that is already in your field, working on that for a long time, and which have accumulated a huge amount of experience that will be helpful for you as well. And then there are diverse projects in where you can participate, projects like related to cleaning a park, projects also related to data entry, working with GIS and map production, geographical information system, and several projects in which you will have opportunity to participate in, and you will be exposed to those during the course of your program. So an aspect we encourage in our students, since we offer a program of global health, is to participate in study abroad courses. We offer several study abroad courses that at the moment they are suspended because of COVID, but we are waiting for the situation to be normalized in regard to COVID, so we can renew, we can continue with our study abroad courses. So they are very important because they will give you this opportunity to know cultures in different continents, very far away from where you are right now. Very different culture, very different knowledge, very different type of addressing problems and making their living. So that will increase by a lot your general culture, and your view will be broadening by a lot. Having this so wide experiences, that's part of what we want to enrich with this program. So we offer courses to London, to South Africa. We are preparing some for India and China. We have one ready to Cartagena, Colombia, which, by the way, is my hometown, but we have to suspend it right a few weeks before it was supposed to start, because it was right when COVID started, COVID hit. We will also have a study abroad to Ecuador and to Kenya, and among other countries that we plan to visit. Entonces, study abroad. And remember, this is one of the courses that you can use as one of the 3 electives you need. So we strongly encourage that one of those 3 electives is one of those study abroad courses. You don't have to. You can get your degree without having a study abroad and just taking a different elective, and that's totally fine. But if you can take one of those study abroad courses, that will be ideal. And we have continuously guest speakers from institution at the government level, at the private sector level, specialists professionals in this field of public health and global environmental health, and global health in general. So that also will be another of the avenues to enrich your culture and knowledge on this program. So Dr. Stephen Jay, he's like the creator, like the father of this program. He was the chair of the Department of Global Health, of Public Health, before we became a school. So before we became a school, we used to be a department of public health within the School of Medicine. So by the time we were a department in the School of Medicine, Dr. Stephen Jay was the chair of the department. And then we became school, and he has been actively related, participating in all our activities. He now retired. He's an emeritus professor, but he still keep having close contact with the school. And he's one of those experts that continuously offer talks, share his experience with our students. So we have the privilege in our campus to be close to so many institutions that are strongly related to health and public health. We have the School of Medicine, many hospitals nearby. We have the global community of our Office of International Affairs, which also provide a lot of information for our students in regard to getting study abroad courses. Different programs. We have the IMPACT project, the CHEER project with the community engagement. We have plenty of institutions, the translational research, where you can get access to information, to internship, to many avenues of gaining experience via them as well. So how do I apply the program? How can you apply? So those are some pathway for you to guide. Those numbers are not updated, so you may want to check for the most updated number, but you should be able to get access to the updated dates by following this link. And also in our website, you get all the information you need to apply to our program. So as I say, I am the program director. Please feel free to reach out to me whenever you have any question and you would like more details about the program. I will be more than happy to provide information you need. Also, you can reach to Crystal. She also will be more than happy to provide all the information you need in order to join our program.